Thank you, everyone. Thank you for inviting me, and it's been lovely. I've been able to listen to a few of the other presenters, and it really has made me think going forward about how our approach is really trauma informed, and how this links with our compassionate approach, which we're going to talk to you about today. So I lead on the Healthier Lives project, and that basically is looking at healthy weight across all ages and trying to promote a healthier lifestyle for all. And we like to embed our compassionate approach, and this is going to be Somerset wide, and we're going to be rolling out some training around this going forward. And anyone who wants to find out more about that, please get in touch with me. This is where we really need to look at where the individual is at, and all the experiences I've listened to this week, it's really prominent that we need to look at what is influencing their choices and their health. We probably need to, we do need to address our unconscious bias ourselves, because we don't need to be judgmental. We really need to be non-judgmental, definitely, as yesterday's presentation told us. So the compassionate approach does take time to embed. It is quite a cultural shift, and I think Steve was talking about this yesterday as well. There needs to be quite a cultural shift in how we look after our patients and our clients. And so we've developed a 10-year plan, and we're going to focus on those relationships and building those relationships into healthier communities. Language is so important, and that's also echoed in those personal stories we've listened to. We really need to embed a positive language going forward. So the compassionate approach has a lot of evidence behind it. Anyone looking at it can see it's built on patient-led experience, which we know is so powerful and so important. But the reason for it, if we look, these stats speak for themselves, really, with 84% of people really not feeling that they've been treated with dignity and respect when they're seeking help around their weight, and only 42% of people really comfortable when talking to their GP about their weight. So we really do need this cultural shift going forward. This is our early years pathway, and you're going to hear more about this today. We have a whole pathway to support families going forward. The Health Visiting Service has developed an enhanced parenting pathway called the Forest Programme, which you're going to hear about next from Sophie. And we've also developed a Splash programme, which is more of a targeted programme for families and supporting them with their weight. And Megan is going to present on that later. But we have a whole universal offer on this, and this provides support from antenatal right the way through to school years. So these elements and themes of the compassionate approach, really, from all the experiences that we've listened to this week, it needs to be accessible, it needs to be flexible, it needs to be personalised, definitely, and non-discriminatory, no bias. We need that consistent messaging, and we need that health gains approach, and that will hopefully help us develop our local policies and influence our commissioners and build those stronger communities that we need to. So without more ado, I'm going to hand you over to Sophie, who's going to actually tell you how it works in practice.
Hi everyone, hopefully you can see my slides. My name's Sophie. I'm one of the health visitors in the Bridgewater team in Somerset, but I'm currently seconded to a pilot project that we have been running called Forest, as Tracey mentioned, which stands for Giving Families Opportunities and Resources for Early Years Support Together. And this was designed off the back of ACE's literature and when on the sort of ceasing of the young parents pathway. So a needs assessment is undertaken by a midwife or health visitor, and they act as a gatekeeper onto the pathway from 16 weeks gestation in pregnancy all the way through to 6 weeks postpartum. And we are working collaboratively with Splash, who we're going to talk to you next. So idea is that once a family are referred into the pathway using the eligibility criteria, which I'll explain next, they are allocated a specific practitioner who will work with them on a needs basis using 10 toolkits that have been developed in conjunction with experts in the specialist areas. So this is the eligibility criteria for the pathway. So we are looking at sort of ACEs in the own parent's childhood that we recognise is likely to have an impact on the outcomes for their own children. And the idea is that we are trying to focus on equity for these families, recognising that actually some families may need more sort of support and guidance, and looking at their individual needs in order for their children to have similar outcomes to families who might not have experienced these things. So when we think about a trauma-informed approach, as Tracey was saying, we're looking at that compassionate approach. So once the practitioner is allocated, they will support the family throughout the process. So at the moment, we're hoping that it will be a minimum of 2 years that the same person will work on an enhanced basis with that family, so that we're able to really build that rapport and that trust with them, and build on those sort of therapeutic relationships. We've developed an agreement with the families that's carried out initially to set a foundation of mutual respect and understanding, so that they know what to expect from the offset, and they can sort of share their thoughts and feelings on what their expectations might be and how they would feel respected from the practitioner. The practitioner then completes a needs assessment to identify what is important to the family, so that all of the interventions can be based on their desires and priorities. So that is within the scope of the toolkits, but it just allows the family to have a bit of empowerment around what's important to them at that time. The forest practitioners have had a lot of extensive training, so they're able to recognise the varying circumstances and complexities of these families, and therefore they can offer contact in a slightly different way than we might otherwise in the universal system. So the families get a choice for all contacts about where they will have their appointments. So this can be at home or a public space, a community venue, somewhere that they feel safe and able to conduct that. Within our working hours, they're given quite a lot of flexibility on the time of their appointments, and also the frequency and duration of those appointments, because some families will find it overwhelming to have them too often. Others will want sort of longer appointments less frequently, and some find it much easier to have sort of 20-minute sessions, but on a much more frequent basis. So we let them have a lot of say in that, so that it feels more suited to what works for them. And then always a non-judgmental view on cancelling or rescheduling appointments due to the known complexities in these families' lives. So we will try and sort of reschedule as soon as we can do, and always remain non-judgmental around any cancellations.
And thank you for the opportunity to come along today. It's been really nice to be able to reflect on Splash as a service, and how we're embedding a trauma-informed approach as part of our system-wide compassionate approach. So I'm just going to share a bit about this today. So I am a paediatric clinical psychologist, and I work within Splash, which stands for Somerset Preschool Lifestyle Activity Skills for Self-Help. We're a service for preschool age children, so those aged 0 to 4 who are living in Somerset with obesity. And we're a multidisciplinary team made up of a dietitian, a clinical psychologist, an assistant clinical psychologist, and a couple of consultant paediatricians. whilst we're a weight management service, weight loss is not an outcome of our service, and because our children are still growing. So really the focus of our support is to support families in developing skills that would enable them to make long-term kind of sustainable changes to healthier lifestyles, and also supporting families to feel confident in making decisions around food, and supporting them to ultimately support their children in developing a good relationship with food and with movement and with their bodies. And we offer quite a bespoke service in that our support really focuses on what families want to focus on. So what feels kind of meaningful to them, and really what feels realistic within the resources that they have available to them. Just to share a bit of our general ethos, which sits within the compassionate approach, we aim to offer a family-focused service where we're family-centred. We consider each individual family within their own context, and identify things that they want to work on that are meaningful to them. We really try hard to offer a service that is supportive and non-blaming, because often prior to coming to our service, families have had negative experiences around, or conversations, around their child's weight that have been perhaps unpleasant or felt quite blaming or shaming. So we really try to understand and validate some of these experiences, and offer a service that is generally non-judgmental. We really aim to work with parents in a way that kind of promotes and protects the family's strengths, in order to support the family's kind of well-being. And a lot of our work focuses on the relationships, I think, that we build with families, in order to kind of connect with them, to enable them to feel heard and understood and validated in some of their experiences. And we found that this is particularly helpful with this service group, because when they've had experiences in the past of feeling blamed or shamed, actually just coming alongside is incredibly kind of valuable to supporting that. And we offer this, as I said, a trauma-informed approach as part of the compassionate approach, which feels really important in paediatric obesity. And I'm just sharing this slide to give you an overview of why actually, trauma-informed care is really important, because the link between early life stress and obesity has been well researched. But there's a lot more evidence coming out more recently around the link between adverse childhood experiences and the risk of childhood obesity. But also the application of trauma-informed care feels particularly important in children and adolescents with obesity, because they're at a greater risk for experiencing negative social consequences that might be associated with living in a larger body. So things like weight-based bias, weight-based victimization, social isolation. So really the trauma-informed framework, we find, really supports a compassionate approach and enables us to have these compassionate conversations with families, whilst also supporting their resilience, which is really, really important for kind of tackling the risk of re-traumatization from these social consequences. I've just put this image in here, which is just a nice visual, I think, to build on that shows how trauma can contribute at many kind of layers, but has these kind of downstream effects on a wide range of adverse health outcomes, and that includes obesity. So really speaks to why this approach is helpful. And just as part of kind of coming along today, we sat down as a team and we reflected on some of the things that we do within this compassionate approach, and thought about how they map across to trauma-informed care. So I've kind of put the principles in blue there as part of our reflections. But one of the things that we found, I think, particularly useful in engaging our families is offering a home visit to everybody that's referred into our service. And really this home visit, going to meet people in their own house, their own environment where they feel safe, really allows for kind of unthreatening and demedicalized conversations around obesity and the associated symptoms of trauma. And it also really enables us to build those kind of trusting relationships with families, I feel, because it's an opportunity for us to kind of actively listen to their stories, their personal experiences, to really understand what's been kind of helpful and also unhelpful about their previous encounters around their child's weight. And also we'll always start off that appointment with just asking for permission to talk about weight, which quite often hasn't been their experience in the past. So that's something that we're finding is particularly helpful, offering this home visit in kind of engaging our families. And we're seeing that we have quite high engagement rates compared to the national average for a service of this kind. And we really do feel that it's embedded in this approach with the home visits. And then some other things that we do, which we feel kind of map over to a trauma-informed approach, is that we really focus on developing that kind of mutual plan of goals with the family. So really collaborating alongside them to work out where they want the support or what they want the support to look like. We try to see our families on a monthly basis. So again, we're quite an intensive support offer, but this just allows those continued conversations around obesity and really gives us a good opportunity to get to really understand and learn about our families and develop that relationship with them. Like Forest, we try to offer as much choice as we can around kind of appointment modality. We find that a lot of our families sometimes struggle to access face-to-face appointments. So we try to offer a mix of face-to-face, virtual and telephone to support that. We offer a multidisciplinary team approach, and that really allows that coordinated care. So we all have a shared understanding of the family's difficulties. And again, I think this really helps with families being validated, their stories being validated by us as a team. And then one thing that we've been really focusing on recently is how we can support our families to access wider resources in the community, and this kind of resource mapping and supporting families to access or signposting them in the right direction, but also in signposting them into services that actually they are going to be able to access. So we really try and focus on making sure that these extra avenues of support are appropriate and accessible, so that we're ultimately not setting up our families for failure. And then finally, the other thing that we've been doing lots of is just sharing our kind of key learnings and the compassionate approach regionally and nationally, and thinking about how we can support other professionals to think about compassionate approaches to weight-based conversations, to avoid this kind of the re-traumatization of some of these negative social consequences of living with obesity. So yeah, really happy if anybody would like to kind of link in to think about these, weight-based conversations and compassionate conversations further. I'm absolutely happy to link in with that. And then also really mindful actually that there's probably a lot more that we can be doing in terms of trauma-informed care. So this today's presentation, as well as this week's kind of series, has really helped me kind of think about how we can, what else we can be doing to embed some of this into our service, because it's really, really important, and I think our families really benefit from us working in this way.
So we've looked at early years, and we've looked at sort of up to 5s and how we look at that with a trauma-informed approach. Steve asked me about older children, so sort of looking at school age. And what came to mind around that was the Body Project. So I just want to quickly tell you about that, and then I'll quickly tell you about the adults, which is around health coaching. So the body project is dissonance, and dissonance means a lack of agreement between the truth and what people want to believe. And I think we've heard that a lot this week. And obviously with body image, this is evidence in our whole appearance ideal, how we see ourselves, how other people see ourselves. And for teenagers, I expect this is resonating with everyone. It's a real issue around self-image and body confidence. So this project has been validated, and it has had a pilot stage, and it's developed in groups in schools, 1 hour sessions over 4 weeks, and they have written and behavioural exercises, all listening to the children and listening to what they really want from it going forward. And it has been developed and evaluated by Stanford University, and the evidence base is there. It's very clear. Hopefully, you can read that through, but hopefully we're just helping these young. This is just for girls, because the research shows that for this sort of work for body image, girls and boys prefer to do it separately. That might change going forward, but at the moment, that's what the evidence is saying. So we're looking at another session for lads as well, so that we're not, being inequitable here. But this actually started first, and this has been going for quite a few years. So not in Somerset, but elsewhere, and it's having really good impact. So it's run by the Mental Health in Schools team, their children's division, and they will contact the schools if you're interested with any dates and venues. They can offer, it is self-referral, so the children can refer themselves in, or you can refer from schools. And the pilot sessions are being reviewed, and there's going to be more of a rollout going forward. I think there's been about 5 or 6 schools so far. So I'm happy to answer more on that. And it's Danny who runs it from Mental Health in Schools, and I can link you with her if you're interested in that project. So looking at adults and the trauma-informed approach and how we look at that, again, with my healthy lifestyle hat on, health coaching came to mind, and our health coaching teams across Somerset. So I hope you're all aware of health coaching. We're trying to big it up. We're trying to get it more known. They are in every PCN across Somerset. They'll be based in every surgery. You'd only have to go on your surgery's website, hopefully, to find them. SASP have quite a few, so if you went on SASP's website, you would find them there too. And what they support with are all these things. So there's lots of issues that you wouldn't need to have, that they can support with going forward. And how would they do this? They would offer 6 sessions, and they can either be one-to-one, telephone, face-to-face, virtual, or group. Some of the group sessions are really, really popular, and they're all very compassionate and done in a very trauma-informed way, where we're listening rather than, I think lots of you have probably got hideous memories of Slimming World. I just think of the comedic value of it, but it's nothing like that. It's definitely a very trauma-informed listening and taking that forward, each individual. So it's very person-centered, the conversations. They have a what matters to me conversation. So similar to what Megan was saying around the families, you really need to know what matters to them going forward before we actually start anything. They identify their goals for the individual. They use that behaviour change philosophy towards achieving those goals. And obviously they use coaching techniques, and they're being spread much wider across all primary care. And we empower individuals then to work towards their own goals without telling them. I think we've been brought up in a world where we tell people to eat less and move more, and really that's not work forever. So we need to listen and see where they are. We need to see where that individual is with and what's influencing their choices and their health going forward. So at the minute, it's an adult-based service, but we have just recently employed some child health coaches, which is a real big step. There's one in West Somerset, and there's one in Bruton at the moment, Bruton area, South Somerset. So that's a big step. It's a very small service at the minute, but we are hoping to expand that. So issues around low self-esteem and issues around weight can all be seen in this very compassionate, trauma-informed way. Also work with the midwifery team to look at pregnant women and making their pregnancy as healthy as possible and supporting them in that. Again, in that sort of coaching manner, rather than being prescriptive. And obviously they're non-clinical, and they coach alongside the clinical staff and have a really good relationship with those clinical staff, which being based in a surgery is quite good, but even when they're not based, they have built up really good relationships. And that's another thing with trauma informed. You need to have those relationships integrated into the service. So I hope we've demonstrated how we, all by working together, that we can support these people, and hopefully in a trauma-informed way. But we do need a bit of a cultural transformation going forward. And I think you've probably all heard that this week when listening to experiences of others. We just definitely need to listen more and tell less.